Okay. Hi, Gail. Welcome to the Lyme Lads podcast.
Hi, Mike.
This-
Thank you for having me today.
My pleasure. This is episode number 2.
Wow.
So we're still getting this thing started. We have an idea of what we're going to be talking about today, but it's probably not as organized as if it was a more established podcast. Just to give you some insight about sort of how this came about, and my cats are just howling. I don't know if you can hear them.
No, I can't hear them.
Okay. Basically, I was connected with a guy named Noah over X, and he was my same age, 31, had battled with Lyme disease for a long time. He had had 2 open heart surgeries in his mid 20s, and we talked on the phone, and for the first time in I think forever, I was able to vent about stuff that I couldn't say to other people. And we related in a way that I feel like only people with Lyme disease can really understand. And I said, wow, Noah, this is therapeutic. And we had the idea to do a podcast, which is the Lyme Lads podcast.
Right.
And then he died shortly after, before we were able to film the first episode.
Oh, I'm so sorry. That's terrible.
So I ended up driving out to Georgia, and I had Noah's mother, Jenny, on for the first podcast episode. And it was, kind of impromptu. Nobody planned for, that tragedy to happen. But I think, in memory of Noah and everybody that suffered from this illness, including you and I both, I think we owe it to everybody to sort of share our story, maybe help those that are suffering feel not so alone, and maybe help those that just don't understand gain some insight into really what Lyme disease is.
Right. Well, I'm happy to help you with your mission if I can.
Thank you. So I'd really like to start out by just kind of asking you about your story.
Okay. Well, let's start at the beginning. In July of 1997, I had gotten dreadfully, dreadfully sick. Uh, I had high fever. I was throwing up like violently for 3 or 4 days, and I really thought I was going to die. I was on the couch, just completely knocked out. It was terrible. We were supposed to go to, I think, Atlantic City for my husband's birthday, and I couldn't even hold my head up. I couldn't move. It was terrible. So I, when I was able to, I went to the doctor. Oh no, no, sorry. Let me backtrack. Sorry. So I was starting to feel a little better, and by no means well. And I went to have some tea and toast, and I was eating the toast, and I was putting the toast into my mouth, but it was just kind of falling out. So I didn't realize that my it was paralyzed. My face was paralyzed, and so I ran to the mirror, and you know, it turned out that I had Bell's palsy, but I had thought that I had a stroke. So, like I said, I was feeling a little better. I went to the doctor, and it was more like a GP doctor, and he did test me for Lyme. Lyme. It came back negative. So I was really not treated for anything at that time. And, I eventually was able to regain normal activities. And I had just got married. And let's see, we were going to go on our honeymoon in October. I did that.
May,
Um,
may, I- may I ask a question, Gail?
yeah, yeah.
You received a negative CDC criteria test, and then when you say you sort of got better, did you just kind of like, go back to, normal life as best as you could? This is before your diagnosis, right?
Yeah, I mean, I did go back to, working and living life as normally as I could. Um, I didn't feel great, and then as time went on, I just started feeling really bad. And I had my son in 1998, um, and I was working full time. So I was always constantly like just exhausted, tired. And then I had my daughter in the year 2000. And again, two small kids. I'm working full time. My husband was a New York City police officer. He's working full time. So I just thought this was a normal thing to just be so exhausted and tired all the time, just with my life activities. But then I started to feel really strange. And what was happening was, it turns out that it was the Lyme that was attacking my central nervous system, and I was losing the vision in my left eye almost completely. So I'd try to like cover it to drive. And my husband said to me, "What are you doing?" And I said, "I really can't see too good out of this eye." And he said, "Well, you have to go get that looked at. That's not normal." And we started talking about my symptoms, and it, it was just, I was kind of like a mess. So I was working downtown Manhattan. I went to St. Vincent's, and they sent me, the doctor sent me to the neurology department, like straight away, immediately. And he he at first thought maybe I had brain tumors. So I had an MRI, and that ruled out brain tumors. He couldn't really figure out what was going on with me. And this guy, he was I can't remember his name, unfortunately, but he was a super smart doctor, and he wanted to do a spinal tap. So I agreed to that because I wanted to get better. I was absolutely petrified to do it, having two small children, and I didn't know what it was going to uncover. And doing the procedure is, I didn't feel good about having to get it done, but I did it. And then that's when he diagnosed me with Lyme. So that's how they found it. But I was untreated for, well, 3 years.
Now, not only did they diagnose you with Lyme, they said it was a pretty aggressive case, right?
Yeah, it was attacking my central nervous system, and other, like joint problems, the fatigue, extreme fatigue. And geez, this is 26 years ago. So trying to remember details. But he did send me to an infectious disease doctor. And being that you and I have connected, I looked him up. He's still downtown Manhattan, the guy who treated me. And I felt he was a really good doctor. He was kind of, I don't know what the word is, not sympathetic towards Lyme patients, but he believed, you know, that I had a really bad case of Lyme disease, and he treated me for that. And at the end of the treatment, he told me, "You're treated, but you're not cured." So
A couple of comments here. You mentioned that he believed that you have Lyme disease.
right,
There's this weird phenomenon with doctors or uh, Western medicine. I don't know what it is, but it's like, you know, you really should be addressing patients by symptoms and kind of going over like, this is what you deal with: joint pain, chronic fatigue, you're having, facial paralysis and stuff, all indications of Lyme disease.
yeah,
But sometimes if you have that negative CDC criteria test, they just say you don't have Lyme. That's it.
right, correct,
So to have a doctor that, you know, believes in you is just so huge. I mean, and that's probably why you got you had IV antibiotic treatment. He treated you for an aggressive, bacterial infection, because he believed that you were really ill.
Right. And the spinal tap had confirmed that. So he, I can't remember if it was 12 weeks that went to 16 weeks or 8 weeks that went to 12 weeks. But I do remember he added another 4 weeks. And I was so disappointed because I just wanted to be done with the treatment, but I remember him adding another 4 weeks to the treatment. And the medicine that I was given, let me just see here. I wrote it down. Ceftriaxone. Um, I remember my mom and I were just discussing the fact that it caused biliary sludge, and that eventually I started having gallbladder problems, and I had to have my gallbladder removed. And when I had my gallbladder removed, the surgeon, when he came to talk to me afterwards, he told me, I have never seen the amount of gallstones that you had. It was amazing. So that's the lottery I get to win, and that's probably from the treatment that I received.
Sure. There's a big debate in the medical industry, specifically regards to Lyme disease, and it all comes down to, I mean, first, how do you diagnose it? Spinal tap is a pretty sure way. Uh, Doctor said that I should get a spinal tap. I was pretty scared to do that. I ended up getting tested with IGeneX, and that confirmed it.
Mm-hmm.
But then it comes down to, so what kind of treatment is proper for this type of infection? And per the CDC guidelines, uh, I believe it was, you know, easy to diagnose. Lyme disease is easy to diagnose, easy to treat with a 30-day regimen of oral doxycycline. And then that's it. You don't like, you're good.
Yeah.
We've cured you.
Right.
So for this physician to not only give you a much more serious uh, you know treatment, but also say, hey, look, we've treated you, but you're not necessarily cured. You might be dealing with symptoms or the aftermath of Lyme disease for the rest of your life.
Right. Basically. And I do have, yeah, I think when we were talking, I told you if I could live on a rock in the middle of the desert, like a lizard, is when I feel the best, just baking in the sun. And we have cold, very cold, damp days up here sometimes. And I can feel it, especially in my knees, definitely in the joints. And I don't think that's just because I'm getting older. I think it's because of the Lyme. And when the seasons change, I have a lot of weird things that go on with my body. And it's every time the seasons change. And I just say, okay, here we go, and then I just adjust to the new season. And it gets worse as it gets colder. So maybe I should move to Florida.
Well, there's a lot more sun in Florida.
Yeah, definitely, definitely. So just still, I don't think that's ever going to change. And I still have some residual effects of the Bell's palsy. When I smile, you can see it's a little off, but I've come to terms with that. So, but there was not, what did the doctor tell me to do? Just like keep rubbing the muscles so it, maybe would stimulate them better. So I used to do that a lot, and I don't do it so much anymore though.
Sure. Well, the sun thing is interesting because you know I, everybody, like the sun is in itself controversial. It's like, oh,
Yeah.
well, if you go out in the sun, you need sunscreen, or uh, you know, is it really that beneficial to get sun? I, I'll tell you that as a animal, if you're sick and you go out in the sun, you will feel better
Yeah.
having been, sitting in the sun for 30 minutes. It's really amazing how good getting some sunlight is.
Right.
And I think people that are chronically ill notice that more than, somebody that has, no health issues, or health issues that they don't really feel every day. So I used to think it was weird, uh, or I look ridiculous because I would sit out in a chair if it's like 65 degrees
Yeah.
and the sun's on you. It's beautiful.
Oh yeah, definitely.
But to tell somebody, hey, let's go sit in the sun, they're like, dude, it's 65 degrees outside. I'm not going to go sit in the sun.
Yeah.
They just don't get it.
Right, right. The benefits of a nice warm dry day. Yeah, at 65 oh, I love it right now. So
Right. What temperature is it there?
I think today we were actually going to get to 40, so the snow is starting to melt, and I don't see any coming. We just got another couple inches the other day, but my birthday is in April, the beginning of April. Last year we got a foot of snow on my birthday. It was terrible. So,
Let me really quick turn my phone on airplane mode because I'm getting some notifications.
okay.
Give me just a second here. Uh, do not disturb. Are you still there?
Yep.
Okay. So I hope that didn't it did end the recording.
Oh no.
It's okay. I'm new to this. We're getting it.
Mine says this meeting is being recorded still.
Oh, yeah, it says that it's still recording, but I don't have the record uh I don't have the record sign on here anymore.
Hmm.
Hmm. Let me let me just end it and start it. Let me just press this really quick. Or no, so it's saying it's recording. We'll just go ahead with it.
Okay.
Uh, so one thing that I think is really amazing about your story, Gail, is you were able to get a diagnosis. I mean, it took 3 years, which is a long time when you're sick.
Yeah.
But you were able to get your diagnosis and then get an effective treatment, which, if we can talk about this for a moment,
Hmm.
I think just to kind of compare your your diagnosis and treatment to mine. Uh, I waited nearly 20 years for antibiotics.
Wow.
So the I mean I was tested per the CDC criteria guidelines. I mean 6 or 7 times in 20 years, and they're all negative. But then I got tested through IGenics. I got my first positive test. Said, clear as day, you've got Lyme disease. I followed that up with a Vibrant lab test. Said, confirmed you have Lyme disease. And I even got another IGenics test. 3 tests now saying confirming that I have Lyme disease. Um, but that's after those 6 negative tests, and even you know I was so sick, Gail. I was in and out of the hospital every other month for a period of 8 months. I was in the hospital like 5 times.
Wow.
Went to the emergency room, was very sick. They couldn't do anything to help me, had no idea what was going on. And I mean, can you imagine going into a doctor's office alone and saying, hey, I think I have Lyme disease. And they say, okay, have you been tested for it? And then you say, I've been tested 5 times and they're all negative.
Right.
I can't, only it's like you really don't understand how that feels and how it looks until you experience it.
Right. Right.
But they just look at you like you're crazy.
Right.
Like there's something about, I think you had a very good doctor, because he believed in you, he believed you were suffering. But I think a lot of the normal experiences that people have with Lyme disease is um, the doctors don't believe them.
Yeah.
There's a term for it. It's like you don't want to go see a doctor. You want to go see a Lyme literate doctor.
Right. Right.
So the idea that there's like a terminology for a doctor that believes that the conventional diagnosis and treatment for Lyme disease is perhaps not correct is interesting in itself. Um,
It's not a cookie cutter illness. I never had indication of a bullseye to start, where I could insist that the first test I had was wrong. I just thought, okay, well, I don't have Lyme because the test was negative. So meanwhile, I was untreated 3 years, which compared to you is nothing. I mean, it just wreaks havoc with your body. So I can't imagine what you went through for all those years. I mean, I know what I was feeling, and it was not good. It's definitely not good.
well, I think one of the main it's just tough because I actually did have the bullseye rash, and that's a good topic in itself. Is uh, I was lucky enough to remember my dad pulling the tick off my back. It was in between my shoulder blades.
Wow.
And I was 8 years old on summer break at my dad's house. He was a hand surgeon, so he's a physician, and he worked the entire summer. So my sister and I basically played outside every day, all day. And I remember as a kid, I wasn't the most hygienic. I mean, how would any 8 year old be when they're at their dad's for summer break?
Yeah, yeah.
So I mean, I recall many times my dad was like, "You need to go take a shower." It's like I wasn't regularly showering and stuff like that. So I came out of the shower and I was looking in the mirror, and on my back I had this big bullseye rash.
Wow, wow.
I'll never forget it. It was like, whoa, what's that? And I could see there was a little something there, and I went down into the basement where my dad's office is, and my dad pulled the tick off my back. He put it in the ashtray and like killed it with a burnt cigarette, and that was it. I never went to the doctor to get antibiotics. Like, Gail, I could have walked to the hospital. That's how close we lived.
Wow.
But my dad was just that wasn't his expertise.
Yeah. I mean,
So
sorry.
yeah, no, you go ahead.
No, even with the bullseye and the tick, and then you're not feeling well, and you still, it's kind of, crazy for lack of a better term that, you
It,
know,
I think a good term besides crazy is negligence.
yeah, definitely.
And I remember that evening, and it's interesting the stuff you remember because we had spaghetti. And I don't know if this was the evening my dad pulled the tick off my back, but it was in that same time. I remember having a pounding headache.
Yes.
I couldn't even eat the spaghetti, one of my favorite meals that my dad cooked. I went upstairs into the bedroom, and I just laid on my bed, and my head was just like, you know,
Yes.
it was just throbbing.
Yep. I had that too for days. It was scary. The, yeah.
But you didn't have the rash, so who knows really when you came in contact with this bacteria.
Well, I think it was right, when I got sick. I think because I like to go outside and garden a lot, and I was doing a lot of that kind of stuff. And right, we had just gotten the house, and I was always outside. But I think I don't know. In my mind, it could have, But you do bring out a good point. It could have been well before that. But in my mind, I was bit right before I got sick. But maybe not. It doesn't have to be that way. So, but I'm sure that's what happened.
I think as an adult, if you come in contact with this bacteria, it might be easier to sort of recognize something's off.
Hmm.
But as a child, you don't know better about anything. You don't know anything about anything. So I mean, if you can picture an 8-year old, or I mean, I really didn't start complaining until I was 13. So about 5 years after I had that bullseye rash and the tick. But even as a 13-year-old, to tell your father, who is a microvascular reconstructive hand surgeon, hey, I'm sick. I don't know what's going on with me. Um, you know, my dad was a good guy, but if your arm wasn't broken, if it wasn't like an obvious thing,
Yeah.
it was, be a man, get over it.
Right. It didn't exist. Right. Right.
Didn't exist.
Hmm.
So I mean, I started asking for. I mean, I started sounding the alarm about 5 years after I was bitten, because I was having trouble sleeping. I was having some weird like cognitive issues. Like I don't know if it was brain fog. It's just something felt off.
Right.
And this early into the infection, the the symptoms were minute enough that I didn't really know if it was anything at all. Uh, but I asked to get tested when I was 13. And it was a big argument. You're not getting tested. You don't have Lyme. I'm not spending money on that. And it took several years.
Yeah.
I was originally tested when I was 16. And at this point, it was like, I had already been asking and talking about Lyme disease with my parents for years. And my dad took me in, and it was sort of like all right, we're going to get you tested, even though I don't think you need it. And then as soon as that test came back negative,
Yeah.
my dad, I'll never forget it. He was like, that was a waste of a couple $100. You don't have Lyme disease. You need to put this behind you. Um, and then, it it was really easy for my dad to say that marijuana was my issue. So as a 13-year-old, I started smoking marijuana, and uh, we don't need to talk about it too much, but in a nutshell, I loved it. It
Hmm.
it was amazing. It was like, and I could only compare it to uh, a situation where I was basically medicating myself
Right.
without knowing that I had something going on. So when I started smoking marijuana, I was like, this is like amazing. This is good stuff. And because of that, my family being from the medical background, marijuana was the devil. Marijuana was the root of all of my problems.
Right.
And for a moment, and this moment over many years, I kept journaling, and I actually believed them, Gail. I
Right.
thought, marijuana is my problem. I picked up this bad habit as a kid, and now it's given me a bunch of problems. So I need to stop marijuana. And so I did. I would stop for a few months, and guess what would happen?
Uh, you'd start up again. Oh,
Well,
you start to feel worse.
I would start to feel worse. I
Right.
would start to feel really bad.
Yeah.
And it's like, uh, I don't know really what the marijuana was doing, but in my opinion, hypothetically, I think it was sort of suppressing the bacterial growth, or maybe it was sort of helping preserve my body. Not my lungs, but maybe it was giving some medicinal benefits. And every time I quit it, after like 2 or 3 months, I would be like, whoa, man, something's wrong here.
Right.
I'm feeling sick, I'm feeling, a lot of stuff, then I would go back to the marijuana. Now I did this over years until I finally got tested. I finally got my positive test, and you would think, uh, or at least this was my thought, and I know I'm supposed to be listening to your story, but it kind of seems like
No,
the other
I
way
love
around.
stories. That's great.
Uh, I thought for sure if if I could prove that I really did have Lyme disease at the 18-year mark,
Mm.
like 26 years old, uh, I thought for sure my parents and my family would come to the senses that, not only was Michael right, but he was right 18 years ago. So now whatever he's dealing with is, a lot more severe. Now we really need to, hop on board and believe that he's sick and help him find treatment. But what do you think happened?
Um, Tell me.
No, nobody, my parents weren't there. My siblings weren't there. It was like, uh, it was like they were parrots of the medical system.
Right,
You've gotten 5 negative tests, and if you search long and hard enough, you'll find a diagnosis for anything.
right, right.
uh, you know you're getting juiced by the doctors are taking advantage of you.
Hmm.
Just very odd stuff. But I thought they would come to my assistance and really be there to support me, but it was the complete opposite. It was,
Wow.
I had finally gotten my diagnosis that, I mean, between taking off work for doctor's appointments, between being chronically ill, bedridden,
Mm.
to paying out of pocket cash for, the I think the IGeneX test at the time, I paid like $1,800 for like
Oh.
a cash comprehensive, like, panel blood work and everything. Um, and
Mm.
by the end of that, I was completely broke. I had no money,
Right.
no support. And if that was a physician in Orlando, Florida, that finally got my diagnosis, and he did do IV antibiotics for patients that had Lyme disease, but it was all cash.
Right.
Doesn't accept insurance. So, here I am, uh, really sick. I know what it is. Finally, I'm right, and I've got, nobody there to
Wow.
help me
That's
get treatment.
Yeah. That's terrible. What happened to you? Honestly. Uh, you're feeling better now?
I'm feeling a lot better now. I moved out to Oklahoma. I finally found a physician that was willing to treat me, that was willing to listen. I started my treatment on oral antibiotics. Another, controversy or subject for debate is the use of antibiotics and how they should be used. So the CDC said 1 month of doxycycline. That's it. You're cured. End of story.
Hmm.
And I always thought in the back of my head, well, if I was tested by the CDC 5 or 6, 7 times, all tests are negative, and they're wrong,
Yeah.
why should I believe that their treatment protocol is correct?
Right.
And another thing is the statistics for, people that are diagnosed with Lyme disease. I think they say, 500,000 new people every year or something like that in the United States. But it's like, I'm not included in that
Right.
because you never diagnosed me.
Right. Right.
So, how many people are going around with, a terrible illness? They're chronically tired, their joints ache, they're feeling neurological issues. Uh, it's Lyme disease, but they got a negative diagnosis. So it's not Lyme disease,
Right. Oh,
according to the government.
right. There's probably a lot of false negatives. I would have to look it up. I wouldn't know, but you know, based on what happened to the two of us, it could be prevalent to be false negative. I don't know.
I would love to have this podcast if we were really dealing with something that there were more false negatives than accurate diagnoses. I think this podcast would be an opportunity just by asking people their story. It would sort of reveal the truth about that.
Right. Right.
Uh, Now, I find this Lyme literate doctor in Oklahoma, and she puts me on azithromycin, ceftonir, and doxycycline for 10 months straight.
Oh, wow.
So I'm on triple antibiotics for 10 months. I mean, this was like we were going all in on this, this treatment. And I mean, Gail, I was very sick.
Wow.
Um, Guess how I felt when I was on the antibiotics?
Well, I would say you started to feel better, but did you have any I remember this and I hadn't thought about it until, I started talking with you this week, but you can actually feel like the shedding of the spirochetes. And, I remember thinking to myself, am I going crazy at the time when it was happening? And I know my mom helped me with that. We had no X in 19, we had nothing like we have now in a very short period of time. There's so much information available. And I feel like more truthful information, not controlled information. So, but anyway, back to your question, how do I think you feel? Well, hopefully you were starting to feel better. I mean, that's a lot of antibiotics for a long time. I never heard of that.
I felt incredible.
Okay,
It wasn't just, I felt better. It was like I got my life back.
great.
Um, and I even I actually stopped the antibiotics early. But, per the physician, I think there were like certain measures of oh, hello.
Ruby.
I guess the question in my mind was, okay, so I get this treatment. How do I know I've completely eradicated every single bacteria, spirocyte bacteria in my body? Like, how do you know for sure? Well, I mean, in my head, you get tested again, and if it comes back positive, then you probably still need treatment. So I don't really know if there's a sure way to say you have completely gotten rid of every bacteria or not. But I felt so good after 10 months. I was like, and looking back at the CDC protocol, I was like, okay, CDC's wrong. CDC's corrupt. They say Lyme disease doesn't exist. They say I don't have it. Well, I ditched their protocol. I went with one that I think, from a doctor who believes I'm sick and has done research into Lyme disease. I've
Yeah.
done a much more effective treatment. So I'm probably good to stop this after 10 months. And I stopped all medications, and, I felt like that's it. I'm going to put it behind me. And then about a year and a half later, I started feeling sick again,
Oh, no.
about 18 months later. So, and I don't know how you could really explain it, but uh, Dr. Richard Horowitz, he's a big proponent in the Lyme disease community, and he has a different treatment with like a high dapsone, still oral antibiotic treatment, but instead of like a prolonged antibiotic treatment, it's short and a little bit stronger. It's like a month-long treatment, but you're supposed to do it multiple times. So it's like you do a month on, you do a month off, month on, month off. And so, I went back to my doctor and I said, hey, I felt great after the antibiotics, but now I feel like I'm still dealing with this Lyme disease after about, a year and a half. And so I did one of the month-long high dapsone treatment from Richard Horowitz, and again, I felt better. Um, and it's like, to argue with somebody that is sick when they say, like if you're on triple antibiotics and you're healthy, you're probably going to feel a lower level of productivity. You're going to feel a lower level of just health. If you're taking all these pills, for somebody that's sick, for them to feel better and then, have to like argue with people about it. If somebody feels better on triple antibiotics, they were probably dealing with something pretty serious.
Serious, yeah, definitely.
So I did one of those high dose dapsone treatments, and then about a year and a half later, started feeling not so great again. Did another treatment, and at this point, I'm just like totally spent out of money. So I've got to in the back of my head, I know that I need to continue treatment, but it requires me to, maybe take a week off at a time during that like high antibiotic period. Um, and it's also between the supplements and the antibiotics. It's close to like $1,500 per like per treatment. And, I should probably do 3 or 4 of those in a year.
Mm.
And I think the big the big difference between Horowitz and like a basic traditional oral antibiotic treatment is recognizing that this bacterium is it's persistent. It's very difficult to treat because it sort of like maneuvers its way into the crevices of your body where antibiotics might not be effective.
Mm.
And have you ever heard of the term biofilm?
Biofilm, no.
So I don't really know what it is, but I'm under the impression that there's like a sticky substance in your body that you know uh, essentially provides safe haven for a spirochete bacterium to hide in the biofilm, evading the antibiotic treatment.
Wow. And I have to look into that. And
Yeah,
then,
and I don't want to talk too much about it because clearly I'm not super researched on it. But Horowitz treatment sort of addresses, this is a clever bacteria, and we need to, not just kill it with antibiotics, but kill the or resolve the environment that it might, you know, hiding in or seeking refuge in your body,
right, right. Well,
by destroying the biofilm.
right. I've never heard of that, but I'm going to look into that. Yeah, you've kind of rekindled my, my interest in Lyme disease, because you get busy with life and everything and don't look at things as much. But it's also very interesting to you and I had spoken about the how much has the treatment changed over the past 30 years, and it seems to be they just want to take this very tricky disease, which is completely real, and just give it a like cookie cutter, cookie cutter, cookie. You did this, you're done, you're done. And we both have, to me, very interesting stories, and our bodies have gone through havoc just to feel better. What like you've had to do so much more than me, and you've lived with it so much longer.
Well, you know, I, I imagine that, like, I wouldn't say that I've had to do more than you or I've suffered more than you necessarily, but everybody's story is a little bit different,
Yeah,
and just that in itself, if you were to break your arm and go to the hospital, your diagnosis and treatment would be the same
Right.
for everybody.
Right.
I went to the doctor, I got an x-ray, my arm was broken. They, put a cast on me, they fixed it, end of story. So just the idea that your diagnosis, your treatment was different than my diagnosis and treatment means that this can't be an illness that's solved with a cookie cutter method.
Right. I totally agree with that. Definitely.
Uh, One thing that we can sort of talk about, you also mentioned that when you were sick, you had your kids.
Right. That was a big concern. Um, oh, are you still there?
Yes. Can you see me?
Yeah. Can you see me?
Yes.
Okay.
Let me make sure we're still recording, and we are.
Okay. Um, like I said, I got sick July of 97 and not diagnosed till the year 2000. I believe it was September or late August because we were going down to the shore. And I remember I had to put a sock, because I had the tube here. So I had to have a sock on my arm to protect it from sand and all that stuff. And so, yeah, my first son was born in 98 and my daughter in 2000 in March on St. Patrick's Day. And I remember that being a big concern because I had said to the infectious disease doctor, is there any evidence that would show, have I passed this on to my children? Are they going to have, they're babies right now. So, I mean, I was very, very concerned and nobody could answer me. So, what do? You take them for their checkups and you monitor them and seemingly, they're fine.
Which is amazing.
Well, it's wonderful. Um,
Have
when you're a new parent with two babies and you get this terrible diagnosis and then you don't know, have I passed this on to my children? You know, that was terrifying, and I didn't know, but I haven't really looked into um I haven't really looked into that to see if other people had the same thing happen. So,
I can tell you what the traditional or the CDC for the last 30 years has said. There's no way, it's impossible. Lyme disease is not congenital. You cannot pass it on to your kids. It's like black and white, hard stop, impossible. And what I've come to learn is any statement that's absolute
yeah.
is typically absolute garbage.
Right. Right.
I mean, because if you say there's no way it can be passed on, to the embryo or, to a fetus, or, if you've got a spirochete bacterial infection, where's the evidence for that?
Right.
Where's the proof? Where are the studies that show this cannot be passed on?
Right.
Which there probably are none. There, in reality, I imagine that absolute claim that you can't pass it on to your kids is probably a baseless claim that we'll find out it is very possible. And perhaps you and your kids got very lucky. Perhaps it was, a grace of God. But I've heard from probably, I haven't talked to too many people with Lyme, but I've heard it several times that, like, mother has it, children have it.
Wow.
And it's like, kid had it from, early age, mom had it. And you would say, well, how did they both get Lyme disease? Well, it was probably passed on at birth. I mean,
Yeah.
I don't know how else to explain that, but so far, your story says, your kids are healthy and fine. So maybe the CDC is right. Only time will tell. We'll just have to hear more stories, I guess.
Right. Do more digging, Mike.
One thing that we can talk about for just a moment is you mentioned X and how like we didn't have X before, and uh, I'll go ahead and say it. Thank God for Elon Musk.
Oh,
Or
I'll second that in a heartbeat.
the idea, and he's just so clever, and he says something like, acquiring Twitter was really expensive, but freedom of speech is priceless.
Right, right,
And the idea that now you can go on X and hear different perspectives, and I can go on X and find people that are interacting with a post about Lyme disease or something like that. I mean, I'm really grateful for X and just the opportunity to connect with people and practice freedom of speech.
absolutely. I mean, X is really the conversation of the world, I think, is what Elon has said. And to me, it's amazing that I can. Well, that's how we met. I mean, we're both here in the States, but I can communicate with somebody from Russia, firsthand. I can see somebody. I can see Elon Musk's tweet in real time. I mean, it just puts us one step closer together. And the fact that he wants the truth out there, so
Well, it, and when you say he wants the truth out there, it's not, you don't get that by censorship.
right,
You get that by allowing people to give their opinions, and this is the news, these are factual events. The people that are making up nonsense stories and headlines, and the info, it's like we're the censorship, we're the information police.
right.
And it comes down to community notes.
Community notes. I was just thinking that. Yep.
I mean, really clever stuff. So don't censor the people that are providing incorrect information, but let's also allow the people that believe differently to share their opinion.
Right.
And then the users of X can make their own conclusion based on two differing opinions and how they want to live their life.
Exactly. I agree. 100%.
We've been seeing some stuff about from Robert Mahone or Malone, excuse
Alone.
me,
Yep.
who I saw him on the Joe Rogan podcast. Super clever guy, way smarter than I could ever dream to be.
Super smart.
And he brought to light that there were a lot of issues with COVID diagnosis, COVID treatment, and that seemed to be like the big wake up call for everybody, was the COVID pandemic and just the way that the government intervened and sort of dictated protocol, and didn't let anybody have like a differing opinion. They essentially silenced physicians that had different opinions. and
Right.
and they made it not only censorship, but I'm going to attack your practice. I'm
Right.
going to make it very hard for you to continue as a physician because of your differing opinion.
Right. Yes.
So that was a big moment, and sort of along the same lines is, well, if the pandemic happened and this was how the government went about it, what other things in the medical industry might not be in the benefit of the patient, but more so in the benefit of the pharmaceutical company or the insurance company? Um, so they're releasing some, uh, like some CIA records regarding the possibility that Lyme disease is it's a bioweapon.
Yeah, I've read a bit on that, and again, that's something that I want to read more on. But the fact that Dr. Robert Malone has basically said that is what was done. The CIA confirmed, the CIA records confirmed it. A tick's being used as a bioweapon against um, a country's own citizens is outrageous. But the fact that it comes from Dr. Robert Malone is lends total credibility to that statement. So I wouldn't doubt it. You know,
I haven't done much research in it either, but I think what Malone was saying is he used AI to analyze CIA documents and did his own research based on that. I'll have to look into it.
yeah,
Uh, we're not going to talk too much about it, but uh, I'm I'm starting to realize today that whenever somebody says, "Oh, that's just a conspiracy theory," like how many of these conspiracy theories do we have to have be the fact, the truth, to understand that the the designation of conspiracy theory is typically from a incredible source that's trying to discredit the truth.
right.
It's like, oh, you know, uh, geoengineering, the spraying, metals in the sky to, reflect the sun and cool the earth. Oh, that doesn't happen. That's a conspiracy theory.
Right. Right.
It's only a conspiracy theory until you have multiple states like Florida and, others that are basically banned. They're, creating laws saying you can't do that here.
Right. Right. There's a meme. I'm sure you've seen it. I see it a lot on X. You know, it'll say conspiracy theory, check, 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 check. You know, and it's really not funny. You know, but
It, it's not funny, but I mean, it is a little funny at this point, like how far we've come from the truth. And right now I think we're in the phase of getting back to the truth.
100%, definitely.
uh, so one conspiracy theory is Lyme disease was created on Plum Island, and I think Plum Island was in the vicinity of Lyme, Connecticut, and somehow ticks ended up getting out of the lab, or who knows, and spread in the area that is closest to where
Mm,
that bio lab was. I haven't done any research on that. you know
right.
who knows? We're not going to really talk about that in this moment. Um but man, it's an interesting time to sort of see, like, different perspectives on how this illness came about, uh, and why it's so difficult to treat, or why it's so difficult to diagnose. And it would make sense that if this was something that we possibly have, the US possibly has responsibility in for creating, that could also make sense why it's so difficult to diagnose and treat.
Right. It is very tricky. Right.
Well, and if the government essentially creates an illness and then also regulates the diagnostic, the testing, they regulate uh, the treatment protocol. It's like, well, so where is the independent research? The government creates the illness, creates the diagnosis, creates the treatment. How can we trust that anything is, you know, studied and unbiased?
Right.
Uh, I've heard some arguments that it's like, oh, we couldn't have created Lyme disease because the spirocyte bacterium is ancient. We've found it in skeletons that are 10,000 years old. Evidence of this bacterium. Uh, and what I'd say is, like, maybe the organism is ancient, but the apparatus for infection that's new.
Right.
This isn't a I don't I'm under the impression that this bacterium was not naturally a tick-borne illness. And that we don't we don't have any proof, but
Right.
there seems to be a sharp incline with people that are experiencing Lyme disease uh, and other tick-borne illnesses like the alpha gal, or the one that makes you allergic to red meat.
Oh, I was just reading on that. Yeah. Right.
And if you think about ticks in general, they're so small. They're they're uh, they're pretty resistant. Like they're pretty strong little
Yeah.
creatures.
Yeah. I don't think there's any natural predator. Maybe a possum? I don't know.
I mean, maybe birds.
Mm.
Maybe spiders and other insects, but it's it's an animal, the tick, that, I mean, it's so stealthy. I
Yeah.
mean, it's like, if you were to create a bioweapon, or you were to think, is there even a chance that bioweapons exist? This organism, the tick, would be a great vehicle to administer said weapon.
Oh, definitely. Perfect little perfect.
Yeah, I mean, it's like you know, it it's the soldier that fights and doesn't,
Right.
it completes the mission in itself. Uh, so there's not much to talk about that, really. Uh, how are we doing on time?
Oh, I can't tell.
Okay, so it looks like it is 2:30. I think we started at about 1:15, maybe.
Wow.
What else do we want to discuss here, Gail?
Um, well, we touched briefly on sort of managing chronic Lyme, which my experience has been uh, dry, hot weather is when I feel the best. And what do? I move further upstate New York where it's gray and, you know, damp. And on those damp days, you can just feel it. You can just feel your body. Um, but I don't mean, I try to take vitamin supplements, but I forget. And I don't, I try to keep my weight down. You mentioned specific diet. I don't eat a lot of red meat. Every once in a while, I do. I'm pretty healthy.
When you say you try to keep your weight down,
Mm.
is that just like, you're trying to be healthy, or?
Yeah,
Okay.
yeah.
And I only ask that because I've got some joint issues for sure. I think your camera might be sliding a little bit up.
Is that better?
Sure. Uh, I think and my weight fluctuates like crazy. It's like, because of the hormonal swings, and I can get into that all day, but uh, it it's very difficult to have issues with your joints and also be overweight.
Oh, definitely.
Like if you're heavier than you should be, and you have problems with your joints, your problems are exacerbated, just by carrying an extra 20, 30, 50 pounds, makes all the difference. So uh, I thought about that when you said, keep your weight down, is like, I got to keep my weight down, just because if I don't, I have trouble walking.
Right. Right.
It's like I have some real issues there. Um, I did want to mention, I mean, if we want to talk about preventative care or what it's like dealing with Lyme disease, have you ever tried juicing celery?
No.
This was something I discovered by Anthony William, who is he goes by he's the medical medium, and he wrote a book about celery juice. And when I was really sick, in and out of the hospital, 5 times in 8 months, couldn't find a solution. My friend gave me a book, and it was laughable. It's like, oh yeah, here's this book about celery juice. And I had that book for a while, and I was like, there's no way, like it can't possibly make a difference. That first time I juiced celery, it was incredible.
Oh,
It within like 5 minutes made me sharper. Like the brain fog was alleviated.
mm.
Um, and from there on, I was juicing. I was juicing 2 to 4 bundles. I was juicing 4 bundles of celery a day,
Wow.
like two at one time, morning and night, for months. And like that was my only treatment, and it literally saved my life.
Oh, that's good to know. Wow. I'm glad that helped you.
Yeah, it was incredible. If you ever want to try it, all you have to do is juice the celery, nothing else. No, don't add any fruit, don't add any anything,
Hmm.
and you drink it on an empty stomach.
Okay.
Don't eat for 30 minutes to an hour, and you'll feel something incredible.
Oh, that's good. All right.
So, as far as preventative care, uh, I mean, I've juiced. I mean, I've probably done it, upwards of like 2 or 3 thousand times.
Oh, wow.
And at one point, when I was, trying to prove to my parents that I was sick, I was collecting the receipts, and anytime I had a receipt with celery on it, I would save it. And my idea was, well, they don't think I'm sick, but who in their right mind would spend, $6,000 or $7,000 on celery?
Right.
Who would do that if they weren't sick?
Right. Right.
It's like, you know, so that's pretty crazy. One thing that has helped me recently is ivermectin,
Oh, okay.
and this kind of circles back to medical corruption and all of the fraud that we saw during the pandemic. This was something that Dr. Robert Malone and Peter McCullough talked about. Is basically any other treatment protocol besides the vaccine. Uh, you know, they made it very difficult to get ivermectin.
Yeah.
They silenced doctors that were saying this might be effective against a viral load. Um, other drugs as well. They discredit it, and they're like, that can't be the solution. The only solution is the vaccine.
Right. And we have to
Uh,
take it.
I say that again.
We have to bribe you to take it with cheeseburgers and lottery tickets and free tuition. Yeah. Nothing.
Not only bribe you, but if you want to go to work,
Yeah.
if you want to travel, you've got to be vaccinated. They made it very difficult for you to continue your life if you didn't choose this medical protocol, essentially. And I've said this multiple times. As soon as politics becomes more important in medicine than outcome and results for the patient, we've major red flag.
Right. Right. I mean, if a patient has proof that a certain medication can help, why would you deny that? Why would you deny that patient the right to choose? Some people don't want to have treatment. They have cancer. That's their right. And some people do, and good for them. And if it works, fine. But if this known drug is proven to help, why can't the patient choose? Right. So that's another whole podcast, though, Mike. So,
Yeah. So we'll wrap up here. I imagine you got to get going. I do just want to mention one thing. There's a documentary about Lyme disease called "The Quiet Epidemic." I think you can find it on HBO or maybe Amazon Prime for a couple of dollars. But we talked about essentially misdiagnosis and the CDC protocol and stuff like that. In this documentary, they identify that the diagnostic testing for Lyme was altered. They removed certain proteins that were strongly correlated with this bacterial infection. They removed those proteins from the test with anticipation of I think it was Lymerix vaccine,
right.
because they didn't want people that were vaccinated to be testing positive with this test. Now, what happened is the vaccine was pulled for, bad side effects or for whatever reason, but they left the testing criteria the same. And it's been the same for the last, I think, almost 30 years.
That's insane. That's just completely insane. I never even knew that.
So check out The Quiet Epidemic, and we'll talk about it later. It's a great thing. Gail, thank you so much for your time and sharing your story. I'm excited to be your friend and communicate with you. And one of the goals of the Lyme Lads podcast is this doesn't have to be a lonely illness. And it I am willing to speak with anybody that is going through a hard time and feels like the world's against them. I want to make sure that they know they're not alone. And I also want to help people that just don't have a clue about what this is, hear
Right.
about it from an inside perspective.
Right. Well, I thank you for having me, for inviting me, and for doing what you're doing. It's very important. Thank you.
Well, you're welcome.
Thank you. Okay.
I usually say my pleasure, but at this point it's like I don't know if I'm rocking and rolling with it. So it's my pleasure to have you on, Gail, and speak with you.
Thank you.
Have a good day, and I will let you know when this is live.
Okay. Thanks a lot, Mike. Take care.
All right. Bye-bye.